Yeah, obviously it's bad. Now, let's say I just took it just a little bit. Let's say I block it 20%. Okay, so here's what happens. The heart has 100 cells die. Sends that information through this nerve, but it gets blocked how much? 20%. Goes through here and goes up to the brain. What is the brain here? What's the message?
80
Needs 80 cells. So brain sends that information on how to heal those 80 cells back through this nerve that's choked, blocks it 20%, goes to the heart. How many cells does that heart build new? 60. What happened to the other 40? They just vanish? No, those cells still remain, but now they're considered abnormal. Anybody ever heard of abnormal cells? For example, in a pap smear. This is what we're talking about. We're talking about abnormal cells. When those abnormal cells, right now it's just 40 and 60 healthy cells again. Does that person notice it today? Not a chance. Do they notice it in 3 months? Not a chance. Do they notice it in 6 or 7 years? Yeah, that's when they wake up in the morning and their chest hurts, or they can't breathe, or they're exercising and they feel fatigued. And now they're concerned that maybe their mitral valve is not working right. If that mitral valve gets blocked, the blood flow is not good, and that's going to affect the whole body. So let's say that happens. Can I use you, Trish? Let's say Trish waits 7 years and that nerve is blocked just to 20%, small amount. And she wakes up and she's got chest pain. Who does she go to? Yeah, she goes to her MD, and what's the MD going to do for her? Pills. So let's say those medicines aren't strong enough. She's going to go back because she still has the symptoms, and he's going to give her stronger what? Drugs. Stronger drugs, right? And those don't work. So now who does he refer to?
Cardiologist.
Surgeon, cardiologist, specialist of some sort. And what are they going to do?
Bypass.
They're going to do a bypass. They're going to do something. Well, let's say it's the most severe case we can imagine. And they decide they're going to completely replace this heart. So who do you go to? Do you go to some schmuck down the road, or do you go to the best guy in the world? Where's the best hospital in the world?
University of Iowa.
Yes, U of I. And it's not BV, I'm sorry. Who has the most famous hospital in the world?
Mayo.
Mayo Clinic, right? So let's say their best cardiologist is going to do a surgery to replace this heart. You're on the list, you finally get that heart. Any idea how much it costs to replace a heart? A transplant? $250,000. Now, let's just say, for example, that your insurance wasn't going to cover that. Who you can go to? Me? Mine give you a heart transplant? Not a chance, right? Would you still go to him? Would you find a way to pay for that? Yeah, would you drive to Canada if you had to? Sell your home and live in an RV or camp? Would you do it to save your heart? I would. Most of us would. Okay, so we go to this guy, pay him $250,000, gives you a brand new heart, you wake up and you feel fantastic. That heart has never felt better, at least for as long as you can remember. Are you healthy again?
No.
What happens in 6 years?
Same thing,
Why?
because you haven't fixed the problem.
Where's the problem? Where should this person have been?
Chiropractor.
Or someone who can check the nerves, or at least assess to see if it could be a nerve issue. How many times do people die of heart disease, like this gentleman who said he's 39 and had a heart attack, no known cause? Could it be that those nerves were blocked? Much more than 20%. Obviously, he's only 39. You with me? Does this make sense?
Mm-hmm.
So, all of medicine in the world, would that give that person health? No. Would surgery of any sort, we could take every organ out and give you new ones. If it's coming down to a blocked nerve, are those ever going to stand? No. The typical heart replacement patient has to have another heart replacement in 7 years. What, did I pick those numbers randomly? No. I mean, it's what science shows, is that every 6 to 7 years, if you've had a heart transplant, because that's usually not the problem, you're going to have a new one. So how do you keep your heart healthy for life?
Have healthy nerves.
It's your nervous system. If your brain isn't able to communicate through your spinal cord to all of these different organs and muscles and tissues and everything in your body, then your body cannot be healthy. So let's take a closer look. We have to figure out what controls all of the healing in your body, and as you already know, it's what? Louder.
Nervous system.
There you go. Okay. Do you mind holding this?
Mhm.
So I've got several articles I'm going to be going through now that I've prefaced everything. This is written by the Mayo Clinic, the most famous what in the world? Hospital. So the title of this is 5 medication-free strategies to help prevent heart disease. First one, don't smoke. Does smoking cause heart disease? Yes, we say. Did George Burns die of heart disease? He was 100 years old, probably smoked numerous cigars every day, lived to be 100. And he died because he fell and hit his head in a tub. So, does smoking cause heart disease? We all know that person who's like 80 or 90 and just won't die, right? They're smoking and drinking. It does not cause heart disease. Can it contribute to an already ill heart because something is blocked right there? Could it be? Yeah, it would certainly exacerbate it. So smoking in and of itself does not cause heart disease. Number 2 on the list, exercise for 30 minutes every day. Did George Burns exercise every day for 30 minutes? He was 100. I doubt it.
He probably walks.
That walking in and of itself isn't enough to stimulate your heart. Let's say, what about the gentleman who had a heart attack? He was an exerciser. Did it prevent heart disease for him? No. Number 3, eat a heart-healthy diet. What's a heart-healthy diet? Fruits, vegetables, but what's the key? It's low what?
Low fat.
Why? Because high fat causes high what? Cholesterol. Let's pick on cholesterol for a few minutes. This is Dr. Ron Rosedale, MD. So I've got a lot to read through this article, okay? So bear with me. Dr. Rosedale says, the latest recommendation given by a so-called panel of experts recommends that a person's cholesterol be as low as possible. In fact, to a level so low they say it cannot be achieved by diet, exercise, or any known lifestyle modification. Therefore, they say cholesterol-lowering drugs, particularly the so-called statins, need to be given to anyone at high risk of heart disease. Since heart disease is the #1 killer in this country, that would include most adults and even many children. The fact that this might add to the $26 billion in sales of statin drugs last year, I'm sure played no role in the recommendations, or did it? Those are his words. It could be that lowering cholesterol might not be as healthy as we're being told. More and more studies are coming out showing just how unhealthy lowering cholesterol might be, particularly by the use of statin drugs, so pay attention here. In particular, statin drugs have been shown to be harmful to muscles, causing considerable damage. A common symptom of this damage is muscular aches and pains that many patients experience on cholesterol-lowering drugs such as statins. Isn't the heart a muscle?
That's what I was thinking.
So that chest pain and considerable damage to your heart, but you're taking the medication for your heart. Again, this guy